It's been more than 3 years since the COVID-19 pandemic changed everything. And across the country, many Canadians are still feeling the effects. Now, top medical experts are calling on federal officials to launch a full national inquiry into Canada's pandemic response. In a series of articles published in the British Medical Journal, doctors have highlighted what they call major pandemic failures in Canada, including the rate of COVID deaths in lower income communities, vaccine hoarding while poorer countries went without, and the crisis in Canadian long-term care homes. Christine Birak joins us live from London with the details. So Christine, tell us more about what these experts are saying.
Yeah, so the British Medical Journal really did this deep dive into Canada's pandemic response. One was also done for the UK, and it found major lapses. For Canada, authors said there were some real successes, but what they were really struck by was the failures, mainly because some of them were predictable and may have cost thousands of people their lives. The successes were in vaccination rates. Canada hit over 80% vaccination, and COVID tests were made readily available. But authors say where things really fell apart was the country seemed ill-prepared for this emergency and really lacked coordination across the country. Even though a report done after the SARS outbreak 20 years ago warned policymakers about some of these problems. So just to give you one example, Ontario data showed some low-income communities faced the highest rates of COVID-19. Racialized people, essential workers who were in our grocery stores were also the hardest hit, and yet vaccines were rolled out in more affluent communities first. Authors also said there was a lack of coordinated leadership across the country and poor data sharing that can often reveal what's going on and inform policy going forward. But the worst criticisms were around how long-term care was handled. The international editor of the BMJ is a Canadian. Have a listen to what Jocelyn Clark had to say.
There had been more than 100 reports sounding an alarm that such a crisis would happen in that setting for a number of different reasons. So this is why the authors call it, a kind of perfect storm that was perfectly forecast and anticipated in advance. There were a lot of missed opportunities and a lack of investment.
So, Chris, we heard a lack of investment also in our public healthcare systems that came up, and the papers did in fact say that long-term care in this country, which we know isn't covered under the Canada Health Act, and private homes that are also not governed uniformly across the country, saw some of the worst death rates.
And Christine, I think what most experts can agree on is the fact that there are going to be pandemics in the future. What can be learned from this study?
Yeah, the authors really tried to emphasize that this is a moment when change can happen. We've just lost 53,000 lives to COVID, and there are real lessons that can be learned. Have a listen to Dr. Sharon Strauss.
This is an opportunity for us to do better the next time. And I think that we really have a moral and an ethical imperative in our country to actually reflect on what happened, reflect on the role that each of us played, and how we can do better the next time.
And Chris, the authors acknowledged that there is COVID fatigue that is set in. As you mentioned, it's 3 years, but they also said that a national public inquiry could allow for real change that would help protect Canadians in future pandemics. Now, for its part, Health Canada, the Health Minister of Canada, says he's open to all reviews. But doctors argue it's one thing to do these reviews and have these papers. It's another to make the necessary investments that will actually save lives next time. And that's what they want to see happen.
All right. Thank you so much for that, Christine.
You're welcome.